Well, good afternoon, ladies and gentlemen. My name is Mark Dunne, and I'm a growth companies reporter at Shares magazine. And welcome to the afternoon session of today's conference, where you're going to hear from 5 companies who are going to explain how they're being innovative to grow their businesses and, of course, create shareholder value. But before you hear from the first of those companies, I'd like to explain how innovation is changing and shaping one particular industry and creating opportunities for investors. And that industry is healthcare. It's very important. I've actually got a bit of a cough at the moment. I've had it for about 2 weeks, so if I do cough through this, I apologise. But apparently it's nothing serious. I was having dinner with a scientist a few weeks ago, and he told me that it's nothing horrible like TB or lung cancer because it's a different kind of cough. But that's the edited version of what he was saying. He was actually going and talking about mucus and things like that while I was trying to eat. So I think lesson 1 is never have lunch with a scientist. Because, before we start, I'm sure you're no stranger to this, so I've got a disclaimer I've got to read for you all, so please bear with me. The seminars today are intended for educational purposes only, and as such are not a solicitation, endorsement, recommendation to make an investment based on the contents of these seminars. Where investment types are mentioned, please be aware that there are other options available. The value of investments and any income from them may go down as well as up. You may not get back all of your original investment. Past performance is not necessarily a guide to future performance. Opinions expressed in these seminars are those of the presenters and not the event organisers, which is Shares and Senco Securities. The event organiser accepts no liability for any losses caused by the use of this information. If there is any doubt over the suitability of a particular investment, then you should seek independent advice. Tax treatment depends on the individual circumstances of each person and may be subject to change in the future. Now, there is a huge amount to get through, so there will not be a time for Q&As at the end. You might well have some questions for some presenters, and if you do, please go and talk to them during the session break or in the exhibition stand. You'll probably find them on the hall somewhere. As you'll see, we're videoing these sessions, which will be made available on the event's website, and we'll email you to let you know when these have gone live. Finally, final bit of housekeeping. May I ask you to switch off all of your mobile phones, just as a courtesy to others. Thank you. Right, got that out of the way. Now I'm going to start by doing something a little unusual. I'm not going to tell you exactly what this presentation's about. I'm going to tell you what it's not about. And I'm not going to talk about Star Trek, science fiction, fantasy. Because what I'm talking to you about today might sound like something out of an episode of The X-Files, but it isn't. It's fact. It's happening. There are people sitting in labs across the country and across the globe today developing this stuff, trying to make it happen, trying to get it to the market. Healthcare is about producing medicines, tablets and technologies, and that isn't changing. But companies are having to be more innovative in the techniques they use to develop that little bottled pill sitting on the chemist shelves and how that drug is delivered into the patient. One such company is a company called GW Pharmaceuticals, and as you can see there, it's using cannabis as the basis of its treatments to ease the pain caused by several cancers or diabetes or epilepsy. It's succeeding. It's got one treatment on the market already, and that's there to ease the pain from MS sufferers. So it's doing a great job there. It's got other treatments in phase 3 trials, and that's the last stage before it gets put before the regulator and they decide whether it can be sold or not in that particular market. So that's moving in. That's taking quite an innovative step there. They do grow the plants themselves in a secret location under a special license somewhere in the UK. So apparently it's a special strain of the plant that they use there. Some of the stuff that was in the lab that sounded like it was science fiction some 20 years ago, close to reality, things like gene and cell therapy. That's where cells are injected into a damaged part of the body, and the idea is that they regenerate dead cells and that they improve your movement or bring back things like lost eyesight. I don't know if you remember in the newspapers probably a good few months back now, was a Polish guy. He got stabbed in the neck and was paralysed from the waist down, and they've actually managed to get him walking again for use of stem cells. They were injecting these cells into what was left of his spinal cord. And obviously he's not walking around happy-go-lucky. I mean, he's on crutches and it's all very, very, very slow. But a couple of years ago, that seemed to be unthinkable that someone who could be paralysed for life could start walking again. So, these things are getting closer and closer to reality. And I'm very sorry if you've just had your lunch, but there is a company called Tissue Regenics. And what it does, it takes tissue from what it calls a human donor, and then it grafts it onto wounds like this. This is something connected to diabetes. And the idea that it will put the skin tissue from a donor onto a wound like that, and it will basically graft together, fuse it together and close the wound up. So there's no need for heavy bandages and the such like. So that's one way that healthcare is moving forward to cure wounds. Now, innovation is also about prevention. Optabiotics is a functional food ingredient and supplement developer, and it's working on the product at the moment to make a healthy sugar, which means that instead of being an anti-calorie, sugar, when it gets into your system, will be treated more like a fibre. So, and you can see the potential of that for certain types of companies that have got, high reliance on sugar. Definitely, I mean, that could definitely change a lot of industries. They're developing that at the moment. They say they could know by September whether they're going to get a steer on that and have something by the end of the year if successful. And that, of course, is the main things here, if it's successful. I mean, these companies are looking at new ways to fix existing problems. Why do they do it? Because the pharmaceutical industry offers such high rewards. US drug developer Gilead Scientist is a perfect example. It sold $10.3 billion worth of hepatitis C drug Sovaldi in 2014. That was the drug's debut year. I mean, this is the pull of the industry for investors, and the drivers are strong for the need to create new and better drugs. There are three main drivers behind the investment case for pharmaceuticals. The first is diagnosis of chronic diseases and is increasing. These are long-term conditions that, fortunately at the moment, there's no cure for. One example there, perfect example, diabetes. It's growing fast. Diagnosis has soared to about 60% in the past 10 years, according to Diabetes UK, which is a charity. 3.3 million people in the UK have been diagnosed with the condition, and that's 1.2 million more than there were in 2005. I mean, this doesn't include the supposed 500,000 people living in the UK today with diabetes and don't know it. There could even be some people in this room or in this building. It's not nice to think about it, but there you go. Doctors are spending 10% of their prescription budget on treatments for the condition alone. That's 130,000 prescriptions a day just to tackle conditions related to diabetes. Reason number two, this lot. Pensioners, loads of them, and their numbers are growing. By 2030, 21.7% of the UK's population will be aged 65 or over. It's according to Moody's, a rating agency. That's up from about 18% today. Pensioners are wealthier today than their parents were, and they don't want to sit in a chair listening to the radio or do day trips to Blackpool. They want to more active. They want to enjoy more of their retirement. Let's face it, they've worked hard enough for it, so why not? The cost of healthcare as a percentage of GDP is rising. In 2013, which is the latest results that we have available, the UK's total healthcare spend accounted for 8.8% of GDP. And what with the fifth largest economy in the world, that's quite high. Definitely. The third and final driver is the emerging markets. People over there are experiencing improving living standards. They've got more money, and then they've got Western-style diseases that come with their Western-style lifestyles. So according to PwC, which is an accountancy firm, by 2020 the pharmaceutical industry will be worth $1.3 trillion, with Brazil, China, India, Indonesia, Mexico, Russia and Turkey accounting for about a fifth of that total. So it's quite a big market. And what we're actually seeing is that some companies in the West that have closed down drugs because of generic competition or just not cost effective are now relaunching these treatments in the emerging markets because there is a genuine need for it. So the opportunity and the market drivers are there, but so are the risks, and they're just as high as the rewards. Getting a drug or a medicine from under a microscope in a science lab and onto a doctor's prescription pad is not for investors with a low appetite risk, or those looking to get rich quick. These companies, especially smaller developers, carry huge development risk for investors. It takes years and tens, if not hundreds of millions of pounds to develop such drugs and before the first even slight bit of evidence that the treatment works or is safe. If it doesn't achieve these targets, the likelihood is that you'll lose your cash and the company will go out of business. So it's no laughing matter for investors. The market is unfortunately dominated by smaller players, and one piece of negative news flow could be curtains for your investment. This is some old data I found, but it's still quite relative. Only 1 in 10 biotech drugs that entered clinical trials between 2003 and 2011 reached a market, according to a US research group. And that doesn't include all the treatments that failed or were abandoned in the lab before they even got to clinical trials. So that number can be much, much higher. The effects on companies that fail are clear from this chart. You can see this over there. This is a medicine redeveloper called Oxford Pharmascience. Now, it dived 20% at the end of July. You can see it there right at the end, when tests proved that a tablet it was developing treats something like gastrointestinal tract irritation. Didn't reduce the condition to the level as expected. So in plain English, it didn't work. It didn't meet its endpoint. It didn't meet its targets. And you can see there exactly what happened. And the company's still operating today. It's still got quite a good little pipeline level of the treatments, but that's exactly what can happen when bad news hits. So the big question is, what do you look for in a company that has no product on the market, no revenues, and needs a shed load of cash for development? Well, there are a few things to look at. One is the quality of management. Look for a company that has a management that have done it before. They've actually taken that drug from the lab to market. There are quite a few of those people around at the moment. It's not just about success. It's also about avoiding failure. You know, an experienced man, woman, or a team, they can spot something early on that needs to change, or maybe a project that should be binned altogether, saving money and time, which to investors are quite important. Evgen Pharma is an example. Now, it extracts the health properties of vegetables such as broccoli and cabbage, and it turns them into drugs that can help fight breast cancer and repair the damage caused by particular types of stroke. It's currently in phase 2 trials. It was established in 2007 by a chap called Stephen Franklin. Now, he's got about 20 years' experience on the commercial side of the life sciences industry, and he's done it all before. He listed a company called Provexis on AIM in 2005, and that was 5 years before a product called Fruit Flow, which is a tomato extract-based product designed to promote healthy blood flow, hit the market in Europe. So he's then sold up, and some institutions approached him, gave him some money and said, right, go off and find something to invest in. So he's done it before, and the industry's got plenty of confidence in him that he knows how to get another drug to market. Stephen O'Hara is another example. He sold a previous company which diagnosed infections such as MRSA. He sold it for about 40 million quid to an American company, and he's now back with Optabiotics. That's the healthy sugar company. Along with the other things they've got going now, they've also got to deal with SlimFast in the UK, where the idea is they're going to modernise SlimFast from, instead of being calorie restrictive, it's going to be calorie restrictive but also fill you up so you don't snack in between. So they're trying to bring that brand into a global brand into the 21st century. Now, another way of de-risking a proposition would be, look for evidence. Has it got any form of research that could hint that it's safe, it works, and could actually work better than existing treatments on the market? That's quite important. Strategy. How are they planning to get the drug to market? It's expensive. So Nergen, it's a respiratory drug company. It develops drugs for asthma and smoking-related illnesses. It's got 2 drugs in clinical trials. Its strategy is quite a simple one, really. It's going to get someone else to do it for them. Basically, the business model is it identifies novel drug targets, progresses them through the early stage in the lab and then into clinical trials, and then licenses them out to a larger player so they can then take on the cost of getting that to market. It's got a deal at the moment with AstraZeneca. I'm sure we've all heard of them. So it's got the rights to its 2 drugs, and it will pay milestone payments to Nergen for however far it gets in that process. And of course, it gets to market and it's a jackpot. It's all good. Sure. Then money. How are they going to fund the drugs development before maybe a licensing deal comes in? I mean, how much money have they got? Is it enough? When will it run out? How will they get more money if it's needed? I mean, these are very important considerations you need to ask. Going back to Nergen, it's got about 10 million cash, burning about £200,000 a month. If no unexpected expenditures come in, it'll run out of money in the second half of 2018. Its drug is not expected on the market until 2022. So there's going to be a shortfall there, but it's got its licensing deal with AstraZeneca, so if things progress well, it should have money coming in from its milestone payments the further along the process the drug gets. That's good. Look at the market. How many sufferers are there? What treatments are already on the market? What market shares are currently likely to take? How much can they charge for each particular pill? These are all things you need to ask. So as a small recap there, things you need to consider when looking at a healthcare company. It might sound like something out of science fiction, or look at the quality of the management. Have they done it before? Are they specialists in this particular market? Do they know what they're talking about? Evidence or research the treatment could work or is more effective than existing products, and of course safe. It's no good if it works, but it has horrendous side effects. Strategy. How they're planning to get that candidate to market. Very important. Money. Will it last until it gets the company to the next revenue generating event? If not, they could be coming back to you guys for more. With some of these companies, it might be best to look at them, instead of buying 1 share today, you might have to buy 5 over the next 10 years, stop yourself from being diluted, because they do have a massive need for cash. It's not coming in, but they do definitely need it in. So if you do find a company that fits all these points, there's no guarantee it will successfully bring a product to market, but of course it will improve your chances of backing a winner. So thank you for your time, ladies and gentlemen. Hope that's given you a little something to think about ahead of our presentations this afternoon. And of course we have the first of our presentations, Ori Weiss, the Group CEO of Excel Media.